Hi, this video will demonstrate the procedure for PICC line dressing change. PICC lines must be redressed every 7 days or when the dressing is soiled, loose, or wet. Here we have a mannequin arm that has a PICC line. Obviously, I won't be able to show you an insertion site because I just have it taped to the mannequin arm. So we've gathered our equipment, we performed hand hygiene, we've identified the patient, we've explained the procedure to the patient, and we've prepared a clean work surface. We are going to open the kit and mask ourselves and the patient. In our kit here, we have an actual kit, and then we have stat lock, which doesn't come in the kit, new tube gauze, and end caps, the Curos alcohol caps. So to open the kit, we're going to have an extra extension connector. We won't need that. Actually, there's a couple of them. There's a pair of gloves in the kit, and there's actually adhesive remover pads, so we may need those, so we'll set them aside. The kit is going to be opened from the bottom. And in the upper part of the kit, there is a syringe in case we need to loosen the dressing with some normal saline. And there's a dispatch wipe. So we could actually sanitize our surface, letting it dry for the dwell time of 3 minutes. So we can do that also. The kit says insert finger under perforation and tear. So we'll do that. And then it's going to open this way. So it tells you every step. Here's for removal, here's for application. So it says tear here. We'll start with the removal. In the removal kit, we have actually 3 masks. So we can apply one to ourselves, one to the patient. I would encourage the patient to perform hand hygiene too. And then there's also hand sanitizer gel in the packet, and actually an extra one. And even if you want to have the patient sanitize with that. And then there's latex-free gloves there. So these are also non-sterile, but we'll use these anyway. We'll remove the net gauze if there is any there. And discard that. And then we can begin to work on the dressing. So if we're having trouble removing the dressing, we can use the adhesive pad removers. We can use the saline if we need to. And typically on this mannequin, the dressing tends to get very gooey. Could see there should have been a date and an initials on that one. We always want to work towards the patient when taking dressings off. So that we don't dislodge the PICC line. For our purposes here, This right here is going to be the insertion site. You would never want to touch it, but typically on a real patient, you wouldn't see beyond this point. Then we would want to remove the stat lock with alcohol. So you could drench that with rubbing alcohol, and that would actually remove that. And I know it's going to be really sticky on the mannequin. Because it always is. I think we're going to have to get some adhesive remover here. I don't have any alcohol wipes, but we should have them handy. And of course, this has made it very slippery. You won't have this much problem on a real patient, although you might. This tends to adhere more on the mannequin arm. So once you get that loosened, then you want to actually take off the stat lock. So from the bottom of this plastic part, you're going to lift up, which my gloves are very slippery now. Lift up that part. And then you're going to actually have an extra piece of tape that came in that front part of that. And you want to, before you completely take this off, you want to secure the bottom of the PICC line to the patient to keep it in place. And then you can remove the rest of the stat lock. Okay. So that was the hard part. So we'll get rid of this stuff. I'm removing my gloves. I have a hand sanitizer kit here, so I'm going to hand sanitize again. And then I'm going to move on to the next part where it says tear here, application. I'm going to remove these items. And I have a drape that I can place under the patient. And we'll kind of make it so that it's mostly sterile. It's not allowing me to open it all the way. So we'll put the drape under the patient's arm. We have to make sure that we're stabilizing the mannequin arm here. Sorry about that. There's more hand sanitizer and there are sterile gloves. So we're not ready for the sterile gloves yet. We're going to kind of leave them aside. But here we have the kit. So we're going to open the kit. This right here is non-sterile. This right here is sterile. The inside is sterile. So we're going to pinch this and open it up. The other thing that we're going to need is we're going to need our stat lock. So we're going to have to put that in the sterile field also. So we'll open that up. let it drop on our sterile field. I'm going to move this back a little bit. And then I'm going to put my sterile gloves on. Okay, I'm all ready to go. Alcohol swab sticks are next. Doesn't want to stay open for me. So we have 3 of them in here. We're going to start at the center, at the insertion site, and work our way out. Get off any blood or residue that's there. Remember, this tape is showing where the insertion site is on my mannequin. Last one. We want to let that dry very well. There's a piece of gauze in here in the step 2 in case you need to remove any debris. This is your ChlorPrep. One step, you're going to break it and then allow the fluid to go into the sponge. You can see it's coming down to the bottom there. There. So we let the alcohol dry, and now we're going to go back and forth with the ChlorPrep. Good 15 seconds. When we're done with that, we're going to discard this. We're going to let that dry. When that is dry, we're going to take this SurePrep Rapid Dry. This is just for the dressing, so we're only going to apply that in a window frame fashion where it's going to go around the dressing. And then we're going to let that dry. The next thing we're going to do is the stat lock. So you can see it has arrows on it where it has to be applied. There's also a skin protectant pad there that we can use. Again, we don't want it at the actual insertion site, so we can just rub this underneath the PICC line and let that dry. Once that is dry, we can put this underneath the PICC line. Again, I like to move towards the patient and allowing this to get in the little groove there. Might have to move it over to get to the other part. Let it snap in place there. And then we can lock the plastic, kind of putting your finger underneath so it's not hurting the patient. Then once that is done, there's a little wing here. We're going to pull that. There's another little wing on the other side. And we're going to pull that. And the stat lock is in place. The next thing we want to do is put the Tegaderm with the CHG, so it's going to be pointing down this way. We can pull off the back. And we're only going to put the CHG over the insertion site. If you put it over the wings and the stat lock, it's going to get all gummy. So we want to put it right there, right over the insertion site, and work your way out. And make sure that the tubing doesn't get stuck there. We can actually remove this piece of tape. And then we can remove this outer part of the dressing. We'll hang on to this because we're gonna label that. This bottom part, you can see it has two little wings that you can hold on to it. Pick up the PICC line and put it underneath. And then we can remove those little pieces. Make sure it's down there good. I like to put this on now and then label it when I'm done and I take off my gloves and everything. So again, these two little pieces that are on the end you want to remove. Then the next part is to get an alcohol prep pad, one of the flushes, and one of the new caps. And we're going to prime this piece here. I would prime that up. Then we can remove this cap. We're going to remove the connector and the Kuros cap all at once. And we're going to scrub that open hub for a good 15 seconds. 15 seconds. Then we're going to take our syringe and connect. And if we're ready to give our medication, we can flush it, administer our medication, and then do the scrub the hub for another 15 seconds once that's done. And flush it again with saline, scrub the hub again, flush it again with heparin, and then we can apply a brand new Kuros cap, which is in our kit. And then when we're all done with that, if the patient wants it, we can apply a new tube gauze. Clean up our mess. And document in the chart that the dressing chain was done. I'm also going to write the date and my initials on there before I cover this up. And make sure it's documented in the chart. Once we're done cleaning everything up, we can do hand hygiene again. And we're done. Hopefully this is a helpful video for you. Let me know if you have any questions.